Hello, my lovelies. If you have cancer or know someone who does, you're going to want to know this information. If you personally have cancer and are going through conventional treatment right now, you may already be well aware of just how awful oral mucositis or stomatitis is. Well, suffer no longer. Of course, these natural treatments are best when started before conventional treatment, but they do also help heal from conventional treatment. And if you are soon about to start chemo or radiation, then it is by no accident you found this video in perfect divine timing. Or you just happened to search it and I came up, because that's what you searched. But either way, this is meant to be, and I'm going to share with you 3 natural medicines that have been very effective against one of the most common side effects of chemoradiation, known as oral mucositis or stomatitis, mouth inflammation, mouth sores. And your oncologist won't tell you this, mostly because they're not educated on this. But these are things I have found to be very effective, like I said, in my own practice, and there are studies to back it up as well. So hi, I'm Dr. Lisa Mateka. I am a cancer transformation guide, naturopathic doctor, energy worker, and life coach, and I help those with cancer navigate their inner journey towards health and wellness on all levels, physically, mentally, emotionally, energetically, and spiritually, to stack the odds in their favor with compassionate guidance and loving support. And today I'm going to share with you the 3 hacks for oral mucositis. So before getting in, let's talk a little bit about it, especially for those of you that may not quite know. So oral mucositis is inflammation of the mucosa of the mouth. Stomatitis is just a type of mucositis that's more specific, involving like lips, the inner cheeks, tongue, back of the mouth. So if you see that word, it also goes in line with mucositis. It's a type of mucositis. And that it can start off just like redness inside the mouth, some redness. As it worsens, you can get ulcers. That's where there's these open wounds in your mouth, very painful. And if it gets really bad and untreated, then the tissue can actually necrose and die. So it is important to come up with treatments for this because it's very common. Over 400,000 people just in the US each year have this side effect. And it's 40 to 60% of anyone getting standard doses of chemo or radiation get it. And that percentage is higher if you're getting higher doses. And it's painful and debilitating. And so here's a bit about why it's a problem. So basically, it's a combination of the local tissue damage, which even if you're not getting radiation of the mouth, even if you don't have head and neck cancer, the mouth area is very susceptible because there's rapidly dividing cells there just normally. And that's what basically chemo radiation does, is it targets areas of rapidly dividing cells, because cancer cells are rapidly dividing cells, but so are, hair follicles, which is why you lose your hair. And then the mouth contains those rapidly dividing cells as well. So the mouth is very susceptible to that tissue damage. And then we got all kinds of bacteria in there. And honestly, most people, and the vast majority of people, have a bad oral microbiome. So there's bacteria in there that shouldn't be there, that are overgrown. So then you got these organisms that can get into the open wounds and create more infections, local and systemic infections even. So that can be a big problem. And then if you have low blood counts from chemoradiation, which is very likely, then your body is not up to speed and doesn't have all the resources it needs to be able to actually repair and heal. And then there's a bit of a genetic predisposition as well. And most at risk are, of course, people doing head and neck cancer treatments, people doing any sort of radiation, higher doses of chemo, more frequent doses of chemo, but still any chemo is still a risk. It's just a higher risk if you're doing radiation or like high dose chemo. And women and younger people tend to be more susceptible. We definitely need to talk about natural treatments because the conventional treatments really do fall short here. Conventional treatments are mostly palliative. They're to numb the pain with numbing agents like benzocaine. Morphine is actually used when it gets a little worse. So they're to treat the pain, and they're also to try to prevent infections that can happen from the bacteria. So antibiotics and things. So the only conventional treatments that are kind of to help to prevent it from getting worse is there are recommendations like getting a soft toothbrush and good dental oral hygiene, and to avoid things like spicy foods, hot foods, tobacco, alcohol. And those are very good things that I, of course, do stand by as well. But what we need, of course, are better treatments that can really help with this, because the reason this is so bad for people as well is, besides the fact that it greatly decreases quality of life because it is so painful, um, also, these people may, and if this is you, my heart goes out to you. It's really hard to eat when you have a certain level of pain in the mouth and moving the mouth. Then there is less of a desire to eat. And we know that that's a problem with cancer patients because they already have a hard time keeping weight on and keeping nutrition in. So the last thing we want is for them to find reasons to not want to eat. And then, of course, if this side effect, these mouth sores get bad enough, then the treatment doses get reduced, the frequency gets reduced, so you may not be getting the full amount of treatment that you need, which of course can be problematic. And and like I said before, it opens you up to infections and potentially even systemic infections. So it's a risk. So let's find ways that we can help with this, and beautiful, wonderful, natural ways at that. Okay, so the first thing I'm going to talk about is Traumeel. Traumeel, Traumeel. If you haven't heard of that, you're probably like, what is that? Well, it's a homeopathic preparation of 14 different things. I'll tell you in a second, but first let me tell you about a study. By the way, disclaimer for all the things I'm about to tell you, the 3 hacks. There are way more studies on them than I'm sharing, and I don't even know if I'm sharing the best ones. I'm just sharing the ones I became first familiar with. And normally, I also don't like sharing about doses for various reasons because it can be very individualized. So, disclaimer here as well. Do see your naturopathic doctor, holistic doctor, whatever holistic practitioner for further help with dosing. But I am going to be providing a range of dosing just so you're not totally out in the cold and do have a general idea of the dosing. And I'm also taking some of the dosing from the studies. So there was this study of Traumeel, actually in kids who had developed stomatitis, so a specific form of mucositis from chemotherapy, and they found that it statistically significantly prevented the stomatitis altogether, or in the ones where it did develop, it did not worsen over time. So a very good thing. And the dose that this study used, swish and spit 5 times daily. The dose this study used was I guess this is not exactly an exact dose, but they basically take as much as you would for what I recommend is take as much as you would for like mouthwash and swish and spit 5 times daily. So 5 times daily, and you want to do this. Ideally a few days before treatment, and then wait a few days to a week after treatment if you didn't develop any sort of mouth sores or inflammation. And if you did, then just keep doing it until that heals. But the frequency from the study was swish and spit 5 times daily. Now, you could swallow, it's not going to harm you, but it's just kind of a lot, I guess. It's a lot to take that much 5 times a day. And because it is an active homeopathic remedy, it could have an effect in your body. So it's recommended to swish and spit And so, what is it? It's a homeopathic preparation of 14 things, mostly flowers. And I do not have these memorized, so I'm going to look. So, we have monk's hood, milfoil, mountain arnica, deadly nightshade, daisy, calendula, chamomile, echinacea, two types of echinacea, the angustifolia and the purpurea, witch hazel, St. John's wort, comfrey, and then also two non-herbal things, calcium sulfide and mercuroamido nitrates, which is a soluble form of mercury. And before you freak out at that, remember this is a homeopathic remedy. So, and I had a misconception on what homeopathy even was until I knew better. But just for those of you that don't know, very briefly, homeopathic remedies are essentially energy medicine because what happens is they take aqueous, basically water, water mixed with whatever the substance is, it could be these flowers or it could be a disease particle or a piece of an animal or like mercury, for example, heavy metals. But what happens is they mix it with the water. They call what's called succussing. They shake it, shake it, shake it, and they dilute it and dilute it over and over and over again. And they keep diluting it and keep diluting it. By the time it's in the stores, by the time you get it, you cannot find a single molecule of that mercury. And that's why a lot of people think homeopathy, the naysayers say it's like snake oil because it's water. But that's the thing that's really cool. That's why it's considered energy medicine because the energetic imprint, the energy signature of that substance, whatever it may be, whether it's the herb or the mercury, is imprinted in the water. And that's why it does work on people. That's why it's not just a placebo effect because it works on animals and babies and all of this kind of stuff. And there's all kinds of studies on homeopathy. But anyways, I know that back in the day when I heard, homeopathic remedies, I thought that was just another word for like home remedies, for like natural remedies. So in case you are like me, that's not the case. It's a very specific type of medicine. So I had to definitely give that little bit of educational spiel when I mentioned that there was mercury as one of the ingredients. Okay, the energy of mercury, no actual mercury in it. About Tramiel, it is something, okay, so it's a little complex. You can find it online at their official website. It does come in pellets and cream. You want the liquid, of course. You want the liquid because you want to hold the liquid in your mouth. You want to do this swishing and spitting 5 times daily. I recommend my patients, I really like, and not all doctors will allow this, so it depends really on your oncologist, but I like when they hold it in their mouth during the treatment, during the radiation, during the chemo. Hold it in your mouth and, if you can't hold it any longer or you need to talk or something, you can always spit it out or swallow it. But yeah, if you go to their official website, you will find a list. It makes you select your country. You'll find a whole lot of countries where it's available, and you can click on that and get it in your area. Funny enough, the US is not one of the countries that has it. Isn't that funny? So, but you can find it in the US through third parties, different supplement distributors, Amazon, for example. Although I always like to give the disclaimer of I never usually recommend getting supplements on Amazon because they are known for having counterfeit supplements. I mean, it's not their fault, it's the sellers or whatever. But it might look legit, like it might look like the exact brand that you buy, like a nice brand, but it's really counterfeit stuff in there. So that can happen. It's probably less likely to happen with something like Tramiel liquid. But so you can find that on Amazon or other third-party places if you're in the US. Also, I must mention, there is a company in the US and they do ship internationally called Uriel, Uriel, and they make their own version of Tramiel called Arnica Echinacea. And they're just such a beautiful, beautiful company. I really, really love them and trust them. It's where I get a lot of my mistletoe. They are anthroposophic, so their stuff is grown like rhythmically. I don't know exactly how it works. There's like anthroposophic farming. I think it's similar to biodynamic farming. I'm not really sure, but they're really in tune with nature and the seasons. And their version of Tramiel, Arnica echinacea, is actually an aqueous extract, so it's water extract, whereas the Tramiel does use alcohol. It's an alcoholic extract more so. And so yeah, you can check Uriel out as well. And you might see things for both Tramiel and Arnica echinacea that say it's for musculoskeletal injuries or conditions, but that does not mean that it's not good for what I'm talking about here. Because especially when it comes to homeopathics, it's going to say on the bottle it's good for this one or a couple things, but there's so many things it can be good for. So don't worry about that. So that Tramiel one, if that one seemed a little, I don't know, complex or overwhelming for you, I got an easy one. Manuka honey. Manuka honey. So we all know that honey, any honey, has wound healing and antimicrobial properties. But Manuka honey, it's known for its myriad of health benefits. And yeah, the thing about Manuka honey is it just has greater antimicrobial benefits. So greater antibacterial, antiviral benefits specifically due to it having more MgO with this methyl glyoxyl, which then turns into DHA, dihydroacetone, and it's this that's really good for targeting those pathogens. And it has all kinds of reasons make it great for wound healing. It's anti-inflammatory, antioxidant. It actually ends up being acidic, but it's good for wound healing environment, and the acidity prevents the breakdown of these proteins that we do want that help repair. It does enhance and support new tissue growth, and it also clears dead tissue. It kind of does this cool thing, this like really balances out the moisture dryness in a good way. It keeps the environment moist enough and not too dry, but it does draw out water from pathogens, which is good because then it helps to kill them that way. And it also draws out water from the the host tissue, which then ends up helping remove waste from it. So there's all sorts of things that help it to be good for wound healing. And there's a couple studies with this one. So there was a study that showed it prevented chemotherapy-induced oral mucositis. And then, which I already talked about, a preventive study with the Tramiel, but here's a cool one. It's also in pediatrics. I think these were leukemia, and these kids already had oral mucositis, so it can be graded from, 0 is not having it, but it can be graded 1 to 5. 5 is the absolute worst. So these kids had either 2 or 3 graded mucositis already, and they were given either Manuka honey, or the control was like the benzocaine gel. That's like the standard of care, just sort of a numbing gel. And there was also a third group that was given a combination of Manuka honey, this olive oil propolis extract, and beeswax. And what they found was in grade 2 mucositis, the honey definitely beat the others, even that other mixture of the other things. The honey statistically, significantly, it was less worse. It wasn't progressing. It was healing a lot faster, healing much faster. And then the grade 3 mucositis, there was less of a difference between the honey and the propolis olive oil beeswax honey combo. There was less of a difference, but the honey still did better. So yeah, the honey definitely beat out everything. The Manuka honey, it was Manuka honey. And so again, I recommend if your doctor doesn't get weird about it and lets you, have it in your mouth during the radiation or chemo. So the dose on this one, I recommend anywhere from a teaspoon to a tablespoon, and then just have some warm water to mix it in. And what you do is you create this, mix the warm water in the 1 teaspoon to 1 tablespoon amount of Manuka honey. and then make a gargle out of it and gargle with it for 15 seconds and spit it out. And then do that again, but this time swallow, because the swallowing will coat the pharynx, and that's really nice and helpful. So you just repeat 1 teaspoon to tablespoon of Manuka honey, mix in some warm water, gargle for 15 seconds, spit, gargle again for 15 seconds with a new batch, and swallow that one. And you want to do this 30 minutes. I recommend doing it, like I said, during, if you can, during the chemo or radiation. But if they won't let you or you feel weird about it, do it 30 minutes before. This is what they recommended in the study. Do it 30 minutes before your treatment, and then do it right after your treatment. That's the most important times. The 30 minutes before and the after. During is the most important in my opinion. But also the study recommended also do that spit and swallow protocol also before and after eating, drinking, and smoking. And that's gonna really, really, really make you good. So yeah, Manuka honey, yes, I didn't mention, it comes from bees that pollinate the leptospermum, oh, what is it again? Leptospermum scoparium shrub in New Zealand, although there is some also found in Australia. And here's what you want to watch out for with Manuka honey. First of all, caution if you're a diabetic for the swallowing part. Of course, if you have blood sugar regulation issues, maybe you only want to do the spitting out part of it. And even then could be, depending, some problems. And then buying it. So you want to look for a UMF rating. That stands for unique Manuka factor. And there's like a scale of, I think, like 1 to 5. And it's gonna, the higher the scale, the more MgO it has. That substance I talked about, the methylglyoxal, that is responsible for its antimicrobial properties. So the higher on the unique Manuka factor scale, UMF scale, the more, basically the stronger and more potent it is. So for an instance like this, when it comes to treating a side effect of cancer treatment, you're gonna wanna get the highest UMF you can find, which I believe is a 5, although a 4 should be plenty. A 4 to 5 I would recommend. And also what's good about seeing any UMF rating, even if it is a 1, is that it means, it's a legit product. It's not a blend. It really is 100% pure Manuka honey, because you might see something at the store that says Manuka honey. You don't see any kind of rating on it. It's most likely mixed with other honeys. So very, very weakly effective then. And then the Australian ones have their own rating system. It's like Australian Manuka Honey Association, so AMHA. You'll see an AMHA instead. So those are the things you want to look for. But yeah, Manuka honey is definitely known for being really great at wound healing. In fact, in 2007, the FDA actually created and approved a Manuka honey wound dressing for mild to moderate wounds. So anyway, it's real, it's legit. This should be easy to find, and definitely Manuka honey, especially when it's pure and real and at these higher UMF rates, it's a little bit more, it's not that pricey compared to a lot of supplements, but it's definitely pricier than your average honey. So be prepared for that. Okay, and then the last one we're going to talk about, although maybe I'll give you a couple bonuses briefly afterwards, but the last main one I want to talk about is L-glutamine. L-glutamine. So what is glutamine? It's an amino acid, and it's a common supplement, so it's easy to find in any supplement store. And most people take glutamine because it's a good cure for leaky gut. It helps to repair the intestinal lining, and it's good for it's good for a bunch of other stuff too. Also, if you have been diving around in the cancer world, you may have heard a lot of things about glutamine being potentially dangerous to take during cancer. It's not. It's a myth. People that don't quite understand the biochemistry have come to that conclusion, and it's good to play it safe, I'll tell you that. So, but once you look further into the biochemistry and the science of how it actually works in the body and how it interacts with cancer, it's yeah, it's 100% fine and safe to use glutamine in cancer, I'll say. And so glutamine. So I have a couple studies on this one. So, and there's some uh, different ways of doing this. Some naturopathic doctors will suggest swishing and spitting because it's like a powder. So you mix it with water, and some will recommend the swish and spit, and some will recommend the swish and swallow. I find more often that the naturopaths are recommending the swish and swallow. I think mostly because we could all benefit from some glutamine. Might as well get the extra health benefits that you paid for, anyways, because it is pretty safe. Although, I guess I'll make the caution now, diabetics, again, need to be concerned and or use some caution with this. Maybe you definitely do want to do the swish and spit method because it can alter glucose levels a little bit and interfere with some diabetic medications. So diabetics might want to do the swish and spit. Everybody else, probably swish and swallow. And there was a study where only 8 grams a day of glutamine prevented chemotherapy-induced stomatitis. And then there's another study where 16 grams a day. So this next study was because chemotherapy, yes, can induce mucositis and stomatitis. So it's great that it prevented that at only 8 grams a day. But the worst is radiation to the mouth. Radiation in general is a little more harsh than chemo for this side effect, and especially of the actual mouth. That is about as rough as you can get. And so the study was in those receiving radiation of the mouth, and they were getting twice the amount of the other study, 16 grams of glutamine per day. And they had statistically significantly less less oral mucositis and less severe oral mucositis. So very, very good. And the dosage they were doing, when I say 16 grams a day, they were doing it at 4 grams 4 times a day. 4 grams mixed in 240 milliliters of water to be exact, swish and spit, and that done 4 times a day. So if you're having a milder form of chemo, maybe you only need the 8 grams, which I would do the 4 grams twice a day, mixed in the approximately 240 mils of water. But it's recommended up to 30 grams. I've, of course, consulted with other naturopathic doctors and things, and anywhere from about 16 to 30 grams a day is what's being recommended. So again, it depends on the person, how much they need, how much, all kinds of factors. And I know that sounds like a lot. Whoa, 30 grams. 30 grams, though, is only 3 tablespoons, so it's not as much as it sounds. And yeah, if you're doing a dose like 30 grams, you could divide that up like 6 grams 5 times a day, or you could still do 4 times a day and alter the numbers so the math makes sense, 3 8s and a 6. Well, my math was right. Something like that, however you want to do it. But that's kind of the general way that it's done in the naturopathic world. So yeah. Oh, the other caution with the glutamine is it can also raise, it's an amino acid, and so having too much glutamine can raise the amino acid arginine. And if you're prone to cold sores, you might get some cold sores. So just something to be aware of. But yeah, I hope you all enjoyed this, or more importantly, I hope you found it helpful. These aren't the only things that can be used to treat and prevent and heal oral mucositis or stomatitis, but they are some of the most common naturopathic go-tos. A couple other ones I'll briefly mention. You can do aloe, pure aloe, not those like sugary aloe drinks. Pure aloe, swish. You can do a vitamin E rinse. So just to sum up, with all 3 of these, the Trameal, the Manuka honey, the L-glutamine, I do recommend, if you can, to hold it in your mouth These are going to be a solution. The glutamine is going to be mixed with water. The manuka honey is going to be mixed with water. The trameal, it can be mixed with a little water, but it's liquid. It's liquid already. I wouldn't recommend diluting it too much. And it's best if you can hold it in your mouth during your treatment, whether it's radiation or chemo. Now, if they don't let you or whatever, do it right before. One of the studies said 30 minutes before. I think that was the manuka honey. And then if you can, do it after. And, these have slightly different doses. So the trameal, the trameal is swish and spit 5 times a day. So throughout the day, just do it 5 times a day. The manuka honey, 30 minutes before, a teaspoon to a tablespoon mixed with some warm water. Gargle for 15 seconds and spit, and then do another fresh one where you swallow so you can coat the pharynx, and do that before and after treatment, before and after eating, drinking, smoking. And the glutamine, anywhere from 8 to 30 grams mixed in water. Do that throughout the day, 4 or 5 times, whatever. And and that pretty much sums it up. So I hope if you guys try these things, let me know how it goes in the comment section. And if you would like to see more videos like this, I figured it was time. I've been doing a lot of the more energetic, esoteric, spiritual videos and more of the personal development videos. I haven't really done a video like this in a while, so I hope you enjoyed it and found it helpful, and I can't wait till next time. Thank you again for being here, and much, much, much love.